Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. It's 2024, the year of the Olympics, and we just had an amazing opening ceremony in Paris. And who can forget those dances on the scaffolding of Louvre Museum? And when we think of Louvre, the first thing we think of is Mona Lisa. What a great painting it is. But did you know it actually took 16 years to complete Mona Lisa? So when I think of that, I think of an artist, Da Vinci, sitting and drawing, and the model sitting still for 16 years. And this is something which is fundamental. We need the model or the subject not to move, to be as still as possible to get the best pictures. And we as radiologists know this really, really well. Despite all the advances, we still need the patient or the subject to be absolutely still. But what if the patients don't want to be still? What if they are sick? What if they are restless? And worse, what if they are very small? And what if they're always crying? That is the challenge with pediatric radiologists have to face every single day. And to discuss about these challenges, how pediatric radiologists still manage to get amazing pictures, still manage to get accurate diagnosis, we have with us the Chief of Diagnostic Imaging of SickKids, arguably one of the best hospitals in the world, the Chief, Birgit Ertl-Wagner. Birgit, it's a pleasure to have you here.
Thank you so much for having me here. I'm very happy to be here with you today. And thank God our children don't have to hold still for 16 years. That would be pretty rough. They would be growing quite a bit too during that time. So
yeah, I think that
would change considerably, which is one of the features of pediatric radiology, that you can have very small infants and teenagers and young adults.
So Birgit, before we go into that, I understand that you have fellowship trained in radiology and neuroradiology, and you were involved in taking care of both adults and kids. And this is all back in Germany. And then how did you decide to move to Canada? And how did you decide to focus on pediatric radiology?
It's a very good question. It was a big decision to make a bit more than 6 years ago when I got this opportunity to come here to Toronto to SickKids. You're entirely correct. I used to take care of both pediatric and adult patients, which I love, but I always particularly love pediatric neuroradiology. I'm a pediatric neuroradiologist, not a general pediatric radiologist, and I always loved pediatric neuroradiology. I consider it an extremely exciting field. It's been very rapidly evolving in the last 10 years or so, with a lot more diseases that we hadn't even known before, with molecular basis and genetic basis of diseases that we had never even thought of. And we are playing an ever-increasing role in really diagnostic decision-making, but also treatment decision-making, treatment monitoring, and treatment itself in an arena where it's really more and more precision medicine, and us being a very important part of this precision medicine. And I find that very fascinating. So when the opportunity arose to come to Toronto to deep dive into pediatric neuroradiology and to lead this division of pediatric neuroradiology, which is a wonderful, exceptional division, I said yes. But it was a big decision to make with the family, and a big move. And
yeah, it should have been.
I didn't regret it.
Should have been a big jump across the pond, but
Sure.
When one of the best hospitals calls you, means that they really value expertise, and that you can come here and push the boundaries of what is possible. And here you are, the Chief of Pediatric Radiology a few years down the line.
Right.
That's amazing.
Thank you.
Because you've done both adult and pediatrics, what do you think is the fundamental difference between them, and what are the challenges in pediatric radiology?
So to answer this, I will need to necessarily generalize in some ways, because adult radiology doesn't equal adult radiology. Pediatric radiology doesn't equal pediatric radiology. It depends on your setting, on your practice setting, on your individual circumstances. So what I'm saying now is necessarily a bit generalized, but overall, pediatric radiology and its subspecialties tend to be a bit less of a hamster wheel. It's a bit less of this very fast-paced, very quickly. Like you said before, it took 16 years to paint the Mona Lisa. Thank God we don't take 16 years for an MRI, but you also cannot run an MRI service for children where you have a spacing of 10 minutes or so. That just does not work. You need some time. You said before, children are crying. We do our very best to turn those cries into this crying into smiles and into laughter. We have child life services, but it all takes a bit more time, which means it's all a bit less tuck, tuck, tuck. It's all a bit less, you have to embrace the uncertainty a bit more, but at the same time, it's also less of this hamster wheel where you're just running, running, running. You do something different every day, and in a way, you do something different every hour. And that I find that very stimulating, and I really enjoy this way of working. In pediatric radiology, you can work a bit more as a generalist if you want to, still cover all different types of chest, abdomen, MSK, or you can work, depending on the setting. At SickKids, we do work very subspecialized in divisions as well, like I'm doing pediatric neuroradiology. There's pediatric MSK, pediatric cardiac. We, of course, have pediatric interventional. We have pediatric body intervention, we have pediatric neurointervention, we have pediatric nuclear medicine. So it's a very varied field, and it just simply doesn't become boring. I find it fascinating every single day. When I first came to SickKids, I chatted with a colleague who had been there for almost 40 years. And she told me, you know, what's great about this place? I learn something new every day, even after almost 40 years. And that's true. That's actually very true. Another difference between pediatric radiology and adult radiology, we're often a bit more hands-on, a bit more directly involved, and there's a lot of communication. A lot of communication with referring clinicians, with your team, with sometimes patients, parents. So you're more a bit in the center of a communication hub, less just at your reporting workstation where you're just doing your reporting things. So it's a bit more around it. So that would be the main differences in a nutshell.
Yeah, before we jump into the communication piece, you're saying that you're adept at turning cries into smiles. You need to teach me and a lot of other parents this skill. But I've been to pediatric hospitals and SickKids as well as in Ottawa, and your MRI suite looks completely different than an adult MRI suite. Whereas an adult, it's just dry. There's just a machine there. Whereas yours is just so interesting, in which there's just a lot of paintings and stuff, and it's just much more friendly with like a bunch of toys. And also in Ottawa, there was this small space before the MRI suite, which had like a tiny MRI kind of a model in which kids could go in and play. And that way they have like less of a worry when they get into the actual MRI. And that's incredibly smart how you kind of managed to do all that. Other thing I wanted to ask you is that, like, in addition to these challenges, for example, let's say if I go and want to buy a shirt for myself, I walk into the shop, there's just like 6 different sizes and that's it. But if you want to buy a shirt for a kid, there's like sizes for like 0 to 3 months, 3 to 6 months, because kids are growing. And isn't this the same challenge you'd face? Because our head coils, body coils in MRI are a fixed size. So how do you handle this in pediatrics? Because you might need different sizes for the entire spectrum of pediatrics.
first of all, we do have a Canadian jungle in MRI, and we love it.
Sorry, it's a Canadian jungle?
It's a Canadian jungle. It's literally a Canadian jungle. There are Canadian animals in like a forest, and it looks almost like a jungle, but it's Canadian animals. It's very, very cute. It's very nice. They actually, once you step out of the elevator at SickKids, those animals show you the way to the MRI. Wow. They're like there, and they show where the MRI is. So you can't miss it. You just have to follow where they show the way. So it's very cute. Even like directly at the scanner, like one of our scanners is the hut for the raccoon, and the raccoon looks out and waves at you. So it's a lot of those things that just make a very technical imaging department so much more patient-centered and so much more friendly. You were talking about like models. We have models of MRI scanners that the children can play with. We also increasingly adapt virtual reality to try out the MRI experience beforehand. That can be even on cell phones with like those special glasses. So there are a lot of ways to do that. And one very, very important way to prepare children for their radiology experience, whichever part of radiology it is child life. We now have our own child life specialist who work with children, who meet the children in the emergency department, on the ward, in the waiting room, and that makes a world of a difference. And it does pay off. You think, oh, there's a lot of investment, that's a lot of efforts that go into that, but it pays off because we need a lot less sedation and general anesthesia when we do those things. So it's actually absolutely worth it. So that was the first part of your question. The second part of your question, you were saying like, with children, one size doesn't fit all. And you're completely, entirely right. And that's also one part that makes pediatric imaging so fascinating and so different from adult imaging. We image from fetus to young adults, really. So fetus sometimes tiny, moving around like making somersaults. Neonates, and a fetus isn't a neonate isn't a toddler isn't a primary school child, a primary school child isn't an adolescent, and an adolescent isn't a young adult. So they're all different. We not only different in terms of size, but also different in terms of development, and fundamentally different in terms of development. And when you think about brain development, for example, our brain develops well into adulthood. We tend to forget that, but even myelination takes place into your 20s. So a lot of development going on, but that makes it exciting because you always have to think, oh, is it right for a child's age or not? Size adaptation, we do have specialized coils, for example. We have specialized probes. We have everything right for this size and the age of the child.
That's amazing that you have very specialized equipment for kids of different ages. But in addition to having specialized equipment, the other problem in pediatrics is that the risk benefits are quite different than adults. For example, for most adults, getting a CT or a PET CT kind of makes sense because the risks can outweigh the benefits. But in pediatrics, you always have to think about what could be the long-term consequence of something which you're doing, which really means that some modalities you would have to think twice or thrice, like especially ones with radiation. And maybe if the kid is very, very small, like fetal imaging, you might also have to think of energy deposition and stuff. And does that like pose limitations and challenges in your work? And how do you kind of overcome it? Is there something specialized you do?
So good question, and correct. We think about any risk associated with imaging very long and very hard, and probably even longer and harder than we usually do in adult imaging. On the other hand, the risk risk-benefit ratio is often very favorable for benefit when you do, for example, CT, and by now we do CT with ultra-low dose.
Okay.
We do tailor our, for example, CT protocols exactly to what's needed, and we go as low as reasonably achievable. And we go especially low. And we have age adapted and weight adapted and height adapted limits. For example, for CT, we have a CT physicist who works on risk assessments all the time and whose job it is to really make this as low risk to no risk as possible. And CT often is the the imaging modality of choice in certain questions. Similarly to MRI, we have an MRI physicist, and we have an MRI safety officer, an exceptional MRI safety officer. And yes, we adapt our energy depositions, our SAR limits, very individually to patient situation, to make this as safe as possible. But the benefit-risk ratio is usually favorable.
So I understand that you do everything in your capacity to make sure that the risk-benefit ratio is very favorable to the patients.
Yes.
But despite all of this, a lot of times parents have a lot of concern because they hear something, they read something. So you need to also find a way to allay their fears. The kid has its own set of problems in which they're restless, crying, which you cannot take care of. And then there's this other piece of communication with the clinicians as to how to advance care. In the adult side, our primary job is just communication with the clinicians. Usually patients are pretty understanding, and we don't have to discuss all of this. But in pediatrics, it seems like you have like at least 3 spokes of communication, one with the kids, one with the parents, and one with the parents, both anxious for the diagnosis as well as for the procedure itself as to what it entails, and with the clinicians as well. So how do you kind of ensure that all communication pieces are taken care of in addition to providing best images and the perfect diagnosis always?
Yeah, that's very important, and communication is key. I think communication is absolutely key in pediatric imaging. And as you said, communication with referring providers, with the clinical team taking care of the patient, with the parents and the child were feasible and were warranted. And also, and very importantly, with your own team. And we have a very large team. We, of course, have our technologists who play a very key role in everything we do. We also have a large team of nurses taking care of our children. We work very closely with anesthesia on an everyday and pretty much every hour basis. We work very closely with anesthesia. So we have a team. There was child life, as I said before, with our clerks. They all play enormously important roles. So you need a team communication with your own team as well to make sure everything flows. So team communication is absolutely key. And in being an effective communicator in that setting, it's really important to be available. They need to know that they can talk to you. Your own team, for example, needs to know that if they're worried about, if they're concerned about something, that they can reach out to you anytime, and where they find you and how they reach you, and that you're available, that you're affable, that you're kind. It sounds so simple, but it's one of the most important things, to be kind and friendly. And in the end, that'll make you safer as well, because when people find you approachable and know where to find you, they tell you if they're worried about something, and it might be something you would not be noticing without your team, the referring providers, the parents. It's just important that everybody feels psychologically safe to speak up, and that in the end will save you too. will keep you safe as well. So I think that those are the key components of.
It looks like that way pediatric radiology is quite different from adults, because the general stereotype which is propagated for adult radiologists is that, oh, they're a little bit reclusive, don't really chat too much. But it seems that one of the fundamental skills necessary to be a good pediatric radiologist is that communication piece, in which you have different styles of communication with different members of the team, the parents, and all the patients in your care.
Yeah, I agree. But I think it's enormously important to have that and to keep that up and, yeah, to be available.
And how do you like being a pediatric radiologist? Like, in terms of work-life balance, does it tilt it one way or the other? Because now you do spend a lot more time in communication. You do spend a lot more time optimizing a lot of variables. As I point out, it's not like a hamster wheel in adult in which things get taken care of. There's always new challenges coming up. Does it tilt the work-life balance compared to an adult radiologist one way or the other?
I think it makes it better, to be honest, because I think work-life balance becomes especially difficult when you are, or when you feel like you're in this hamster wheel and you're just running, and basically it always turns and it's always the same and you don't get out of it, and you have the feeling, okay, I'm running, and the morning is the same and the afternoon and the next day is the same, and you just have to run, and often you have to run faster and faster and faster because it's ever more imaging that needs to be reported within an hour or within a day. Having a more varied demands on you beyond just quote unquote, but beyond reporting and communicating with a lot of stakeholders involved, also gets you a bit out of this hamster wheel as well. So I do think it doesn't get boring. It doesn't get boring. Sometimes it can get challenging, no question about it. Sometimes it can get very fast-paced as well. Demands can be very high, but it's typically not this repetitive doing more of the same all the time, but really being challenged with very different things that your brain is challenged to adapt, and at the same time it doesn't get monotonous. And importantly, when you do what you love, you really never work a day in your life.
That is true.
At the same time, you of course have to make sure that the hours that you work and the hours that you have to spend with your loved ones, with what you care outside the hospital, care for outside the hospital, is maintained. And it's one of the challenges we all, both adults and pediatric radiologists, need to work on and need to make work, especially when we are in leadership positions. We need to make sure that this balance is reasonable.
So it seems like every day you do have challenges, and you overcome these challenges every day, which gives you a great sense of accomplishment rather than kind of doing the monotony of doing the same thing over and over.
Yeah.
And it makes sense, because some research has shown that quite a lot of times burnout is not just due to the volume of work done. It's just because people feel that their contributions are meaningless. Yeah. Whereas you feel really satisfied and accomplished every day, which probably tilts the work-life balance to the beneficial side.
Yeah. I very much agree with that, yeah.
In terms of differences, what do you see the future of pediatric imaging going? Is there anything new on the horizon which is going to radically change it? Is there any technology, or what's the biggest change you anticipate down the line?
So I'm expecting the future of pediatric radiology to be bright, very bright. And I'm very convinced it's going to grow. It's going to continue to grow. It's been growing steadily, and it'll grow further. I said in the very beginning that we now diagnose diseases that were unheard of 10 or 20 years ago, that we are now classifying subtypes and subforms and new disease concepts that we hadn't known even a few years back, and that we now play a role in really prognosticating treatment response, in assessing treatment response very differently. And again, being involved in treatment and in administering therapeutic agents exactly to where they need to be. And this is going to increase. So the demand for pediatric radiology, both here in Toronto and worldwide, is going to continue to increase. And there is a big need for pediatric radiologists worldwide. So the future is exceptionally bright. What technological changes will we have? On the one hand, image acquisition, we're getting ever faster, which is great for pediatric imaging because it makes it easier. We need less sedation. We can image at younger ages without sedation. It'll become ever more gentle in a way that we are ultra low dose now with most things that involve ionizing radiation. It becomes, from an interventional radiology perspective, ever more precise, ever more minimally invasive, ever more targeted. AI is going to play a role, it's already playing a role. It'll play a role in triaging our patients, in prioritizing, in diagnosing and predicting, in precision medicine. In a way, is it going to replace us? No way, no way, never ever. I told you before, we're doing very things like you do something completely different with and for every patient. Every patient has a different age, has a different diagnosis, and it's a skill set that I'm not expecting AI to take over any time on the horizon, because it is just so very unrepetitive. But AI will be able to help us more and more by flagging things, by being an assistant, a nice assistant, but not an assistant that'll take over any time on the horizon, really. So cut a long story short, future of pediatric radiology is exceptionally bright.
Okay, in terms of a specialty, pediatric radiology, I'm assuming takes care of kids till they're 18, and then after that it becomes adult radiology. So in Toronto, we have SickKids, and next door we have Toronto General Hospital. So till they're 18, they're taken care of by SickKids, and then they're shunted across. And quite often you find that this distinction is just quite abrupt. And it's difficult to have continuity of care because everything changes at one single time point. And this is not just true of clinical care, but also of research as well, in which it's just very segmented into pediatrics and adult side. And you are the vice chair of research for quite a long time. What do you think needs to be done to improve this continuity of care between pediatrics and adults to make the transition less jarring, as well as to improve collaboration between the pediatric and the adult side?
So, excellent question. I completely agree with you that this cutoff at the 18th birthday is A, very abrupt, and B, very arbitrary. It's not that with an 18th birthday, a young human being changes from one day to the other. It's a continuum growing up, really. Yeah. And you grow up for a long time, and as humans, we ideally keep on growing all our lives. And in young adulthood, in adolescence and young adulthood, for example, from brain development, we know that brain development, I mentioned that before, continues well into the 20s. So this adolescent, young adult, AYA concept is very important. And in the way we kind of segment care, we kind of put down a line in the middle of this AYA age. But in that age, they can have pediatric diseases and adult type diseases. You can have a 23-year-old with a typical pediatric disorder, new diagnosis, and vice versa. We can have a 17-year-old with an adult type tumor, for example. So I think it's very important that we all work very closely together, that we move more closely together, and that we make this continuum of care as seamless and smooth for the patients as possible. At the same time, for research, I think it's very, very important that we join forces for many reasons. Here in Toronto, we have great strength. We have wonderful sites, adult and pediatric, and we have a lot of methodological knowledge. We have huge databases, sample sizes. If we join forces, huge.
Absolutely.
At the same time, we are a bit siloed. We are a bit siloed in our pediatric and also different adult institutions, if we're entirely honest. But if we join forces, we would be so much stronger. We would be so much stronger because sample size, all our knowledge pooled, we'd be invincible, quote unquote. And I just wanted to mention one more thing. The entire concept of lifespan, I think, is becoming increasingly and ever more important in research, in research and in the clinical setting. You look at development, be it brain development or other development, and you look at degeneration, and you can learn from development how degeneration may happen and what to look for. So I do think it's enormously important to have a concept of this entire lifespan from very early fetal development to old age to really optimally care for our patients and to really push the boundaries of imaging care. So I think there's a lot we can learn from each other.
Do you think that to break the silos, having something like a new specialty in radiology like genetic or hereditary or congenital radiologist, in which that radiologist takes care of the kid right from birth or even before birth to their entire lifespan, would that make more sense?
It's a very interesting question. We currently don't have that, and it would break all those silos and boundaries. And for the patients, it would make perfect sense because for them, it's often very hard. They were at SickKids, and they've always had the SickKids imaging care. They came to our Canadian Jungle MRI till they are 18, and then they're pretty abruptly in the
all of a sudden no Beaver for you
system. And oftentimes those very rare diseases that they're suffering from are unheard of on the adult side. So it's a very interesting idea and concept.
Birgit, one last question to end it all. What do you think are the soft skills necessary to be a good pediatric radiologist? Or do you think that some people would be good pediatric radiologists and some would not, and who should choose it? So for any trainee out there who's thinking of becoming a pediatric radiologist, what advice would you have for them?
Excellent question. And to begin with, in pediatric radiology, you can find different ways of working too. Not, as I said before, not every pediatric radiology is the same. So it's different types of personalities that flourish in pediatric radiology too, because it's not always the same. So again, what I'm saying now is going to be a bit of a generalization, and there are different ways of working for sure. Generally, I think important soft skills, empathy. Empathy is key. It's just really important when you go into pediatric radiology or field, a pediatric imaging field. Be it another subspecialty. It's important to have empathy. That's just very important. You have to care. Otherwise, it's not going to be for you. It's important to be a team player. It's just, we've spoken about that before, that we interact with so many different teams and so many different people. You have to be a team player, and you have to enjoy interacting with people. It'll make you a lot happier when you enjoy interacting with people. I personally think it's important to stay humble. I think humility, being humble, is a very, very important character trait. If we become arrogant, if we think we know everything, we become dangerous. I think humility is important, and it's super important in pediatric imaging, because you just have to know when you don't know, and you have to know your limits and your limitations, and then you have to be humble enough to ask somebody else, or to tell somebody else, I think we really don't know what this is. It's better than saying, oh, I know it all.
Yeah.
So I think that's very important too. Generally, I think pediatric radiology, or any field within pediatric radiology, is a wonderful career choice. It's a wonderful career choice, and yeah, anybody choosing it, I would just say, yeah, great choice.
Ladies and gentlemen, there you have it. Pediatric radiology is one of the best choices that you can make for your career, if you're thinking about it. Da Vinci took 16 years to make his masterpiece, but Mona Lisa, even after 16 years, was not perfect, because after 16 years, it was still unfinished. It was unfinished at Da Vinci's death. But in pediatric radiology, you don't get 16 years. And it's not enough that your masterpiece is great. You've got to get perfect images every single time. Not just perfect images, but also accurate diagnosis from those perfect images. And this way, I think that you are better, you're more famous than Da Vinci, because you do this every single day and you have new challenges every single day. It's often said that children are our best resources because they're going to take care of our future. But in order to make sure that they can take care of our future, we need to take care of them at present. And one of the best ways to take care of our children of the future is by becoming a pediatric radiologist. Ladies and gentlemen, that was Dr. Birgit Ertl-Wagner, Chief of Diagnostic and Interventional Radiology, SickKids, and me, your host, Satish Krishna. See you in the next one.